This is Tom Goolsby, and this is my column for the first week of May 2013. It's entitled, Pastime to Increase Competition in Health Insurance. As the uncertainty of Obamacare looms on the horizon, state lawmakers have not been content to sit around and wait on the coming storm. Instead, the General Assembly recently passed legislation that will help to take a bite out of spiraling health care costs. It's called House Bill 247, entitled Freedom to Negotiate Health Care Rates, and it prevents health insurance companies from restricting rate negotiations in contract agreements with health care providers. Now, specifically, the bill goes after Most Favored Nation, or MFN, clauses in contracts between health care providers such as hospitals and large insurance companies. MFN clauses can require health care providers to offer services to large favored insurance companies at rates equal to or lower than those extended to any other competing insurers. Many times these clauses also require providers to disclose their contracts with smaller competitors. Now, these clauses impair or outright prevent small insurance companies in many situations from competing because they cannot negotiate lower rates for health care services. The U.S. Department of Justice has weighed in on this situation. It called the practice, quote, anti-competitive because it effectively blocks and locks in a large insurance company and drives potential competitors out of the marketplace. The inevitable result, once competition is stifled, is an increase in cost to consumers by the large insurance company who has now, in effect, a monopoly. By preventing health insurance companies from including MFN provisions in their contracts, House Bill 247 will ensure that doctors and hospitals can freely negotiate lower reimbursement rates with any and all insurance companies, regardless of size, for the services that they deliver to patients. A similar bill was passed last session and sponsored by then Insurance Committee Chair Tom Apodaca, a Republican from Henderson County. It languished in the NC House and was never heard. However, with the bill's recent passage, Apodaca was upbeat, saying, creating a streamlined regulatory environment includes making sure the rules for insurance providers are fair across the board. Senator Apodaca added, this bill creates a level playing field for insurers to deliver services at lower cost to North Carolinians. The potential impact of this legislation cannot be overstated. It has the ability to save North Carolinians tens of millions of dollars in what would otherwise be spiraling health care costs. It's shameful that in years past, whether through effective lobbying by large insurers or through sheer ignorance, the General Assembly never saw fit to deal with this issue. A monopoly works well for the kingpin who holds all the power and money, but not for the rest of us. This bill won't solve all of our problems with health care, but it is a significant tool to help reduce costs in the future and ignite competition to provide less expensive medical procedures and services. I'm Tom Goolsby, a state senator, practicing attorney, and law professor. I'm also co-chair of the Senate Judiciary I and Justice and Public Safety Appropriations Committees, and I wrote this article. Thank you for listening.